the things I tell the students sometimes is, when they're asking me, well, how do I know what I'm going to go into? And I'll say, you can go into what, you know, fascinates you intellectually, or you can go into a specialty where you'll take care of people, where, you know, your heart just goes out to them and you really are motivated to take care of them. And I think that gets to an important question, which is really, what is geriatrics? And if one thinks, well, the geriatricians are people that should take care of everyone over 65, then I don't know, we would need 40,000 geriatricians in the United States to take care of all the older folks. And so what geriatrics really does is it focuses on people of very advanced age, and by that I mean 80, 85 and older. Or it focuses on people in that 65 and over age group that have multiple complex medical problems, that also may be very frail, or that are having or that suffer from particular conditions like dementia. Not a lot of people go into geriatric medicine. I think there's, you know, several reasons for that. I think one thing is it's not a specialty that's really felt to be really exciting, again, like emergency medicine or surgery or that kind of thing. I think that's one thing. But also I think that that there's tremendous debt in medical school now. The average medical student's $150,000, $170,000 in debt. And going into geriatrics, you're not necessarily going to make any extra money. Medical schools will have electives in geriatrics, but very few have any required geriatrics rotations in the third and the fourth year. The third and the fourth years where students really become active clinically. So very few schools have any required geriatrics. Here we're developing our third and fourth year now and having discussions about how much geriatrics do we need to put into the curriculum. In a course, for instance, like physiology, the students will learn in the physiology course about normal changes of aging. One of the other things, of course, we do is that as the students do their clinical rotations, we give them talks. We talk about cases that are geriatric specific cases. So right now, like with many medical schools, the geriatrics is sort of sprinkled in. One of the questions that, you know, I look to and try to address is that sufficient to have it sprinkled in, or should there be a more concentrated period of study to consolidate it more? You know, we're under development, you know, and things are growing and evolving, and certainly I know that Dr. Schuster, who's our dean here, is very committed to geriatrics and really considers herself a geriatrician. And so I think that there's a lot of support here for doing that sort of geriatric medical education.